How do I help new grads become more confident about sales
Welcome to the Investor Center. Bye-bye.
and about getting the kind of results
Just like that, I made $2,000.
that we have been able to get consistently with our clients? This is a question that I was asked recently from an actual new grad, like, when do you get to a point where you feel confident? And I think that varies among different people. I think it depends on how hungry you are as a clinician coming out of grad school, because grad school is just the bare bones of passing your boards
You'll find your way after grad school.
and giving you some foundation of how to think critically about the patients that you're going to be seeing. Back in the day, I used to worry about, oh, I hope I can get this person better. In our case, it's great because we have a lot of experienced clinicians at any of our locations in New Jersey or in North Carolina. Obviously, I'm here, so I can provide that mentorship as needed. But what I have found is that if you give a system for a new grad to pick up and learn and know what to look for, know what things are relevant for that given patient, do a couple sessions with your, or basically co-treating with your new clinician coming on board, it's very, very helpful. And one of the approaches I learned from my good friend Tom Padilla out in Arizona, which was the fixed approach. And obviously I've been practicing for a long time, but even I love to still learn, and I still get very curious about how I can get better myself, even as a clinician, because I know that if I can do that, I can pass the knowledge on to our other clinical team as well. And for me, I just like to learn. So I think that has stayed steady. And learning the fixed approach from Dr. Tom about how he treats low back was really helpful in helping me to systematize how we treat low back pain, and it's been very, very successful. And the best part, it's been very easy to transfer over to new staff. So Dr. Megan, for example, who graduated from Duke about a year ago, she came into our practice and I just taught her the basics of what we were doing. And I think more than anything, what I told Megan was, listen to how I say things
Listen.
to our clients, because I don't always have the right answers, but I know that I can basically break things down to a point where it's going to be these different possibilities, and from these different possibilities of what the root cause might be for this patient, we're going to try this first and see how that goes. Now, that's something that's very easy. I don't know if it's taught in school or not these days. I've been at school for a long time, but it really helped her, I think, in getting the bare bones down of how to take something with a complex issue and break things down to a very easy way of finding the root cause and treating the symptoms as a result. But I think that more than your clinical knowledge, because frankly, I would put Megan to any OCS out there as far as being able to treat competently, and more than anything, gaining the trust of my clients.
People trust her.
I think she's at that level, even as a new grad coming out, because we gave her a very simple system to use that she could figure out, like, if this and this, more kind of algorithmic. Now, obviously, people are going to be outliers, and that's when I'll get a call or I'll get contacted from Megan saying, hey, I'm noticing this, things we're doing are not working. So that's where having a clinical mentor can be helpful and say, well, let's just wait a little longer, because this person's had this for a long time. We happen to see a lot of people with long-term injuries or chronic injuries. And so sometimes things just take time. But giving that confidence to our clinicians, and then also creating a framework, a system for our clinicians to pick up things easily, is really what's going to help to get your clients to feel better faster and sooner, and get the results that both the clinician and the clients are looking for. So if you're out there and if you're a new grad and you're trying to figure out a way to get better at what you do clinically because you don't have the experience yet, I want to encourage you to, number one, focus on how you're speaking to your clients. Now, in another video, I talked about the 5 ways that how they rate clinicians, know they're finding a good PT. That might be helpful for you, because a lot of it is not clinically based per se. It's how you frame things, how you say things. And you know enough coming out of grad school to be able to treat 80–90% of the patients out there. You do. I don't care where you went. I don't care, whatever. As long as, and number one, you stay curious about what is going on with your client, you will find the answers for the most part. I would say that, Megan probably has, and some of our new grads, Anthony up north, probably have better book knowledge than I do. I'm pretty rusty in some ways, and I'm a lot older right now. But giving the simple framework of figuring out how to deduce what is going on, what to look for, is fairly easy. And because we have the time to do that, because we see patients on the hour down here, it becomes even better for someone like a new grad coming on board to have the time to really think about things, critically think about things. So when you have the time, plus the curiosity, plus a little mentorship, and the right framework and system to help a new grad feel confident about treating whatever comes through that door, you're going to be on your way to not only being successful as a clinician, but also being able to get your patients to feel better sooner than later.